Hi viewers, welcome back. In today's video, we are going to discuss about rhinitis. Okay, so rhinitis or common cold. Okay, so rhinitis, it is having a lot of names: nasopharyngitis, coryza, common cold. So all these are different terminologies we use to describe rhinitis. Okay, it is just the running nose we say in common terms. So rhinitis is nothing but the inflammation of the nose and the upper GI tract. Okay, so that we term it as rhinitis. Then we come to the etiological factors. So when we come to the etiological factors, it can be a viral infection. So very common is the viral rhinitis. Okay, so usually these virus they get, so you know virus, how does it spreads? It spreads by droplet infection or by the surrounding environment. So when you come across a virus, so usually the virus they get deposited in your clothings, in your things like whatever you are using, your bags, the cycle or the bike, the pencils, pens, whatever you are using others. So whomever that is already infected with a particular virus, when you are coming in contact with these viruses, they can stay for a long time. Okay, so when you come in contact with these viruses, you are getting exposed, and when you are having some immunodeficiency, or otherwise when your immune systems are not functioning properly, you have some physical illness or some emotional weakness, something is getting disturbed, you stress, all these factors they can attract these viruses very fast. Okay, so when you are getting exposed to these viruses, you are having an exposure, and this is causing an inflammatory reaction in your body. So when you are getting exposed, what does the pathology or the pathophysiology, what is happening? When you are getting an virus inside your body, you are getting your inflammation process beginning. Okay, so that is your, the virus enters, there will be a swelling in the nose. So usually what happens, your antibodies they start fighting against these viruses. Okay, so sometimes it is bacterial also, but it is very rare. Most of the time it is viral infections. Okay, so at that time you have your antibodies and antigens, they are going to fight, and it is going to send this microorganisms out. So usually there will be a mild rise in body temperature. When this inflammation process is taking place, there will be symptoms that is related with the inflammation. So usually you will have a low grade fever. So the fever may be less than 101 degree Fahrenheit, and there will be generalized body pain, that is malaise. Tiredness will be present, so you want to take a rest, so you can take rest. Sometimes there is like you will have nausea and vomiting also can be present, and sometimes like you will have running nose, continuous drainage of the secretions, that is like your running nose will be present. And sometimes there will be swelling in the nose, redness, itching will be present over the nose. Sometimes there is itching present at the back side of the throat. So all these are symptoms which is related with your rhinitis. So when you are having symptoms related with the rhinitis, it indicates that you have to do some management. So it is not always with medicines you have to go and treat, you can just go in for home remedies. Okay, so when you come to the types of rhinitis, usually you have three common types of rhinitis. One is the bacterial rhinitis, I said it is a rare invasion, and then we have viral rhinitis. Again it is very common. Viral rhinitis are very common when you are getting exposed. Okay, so when you are getting exposed to a virus, you get rhinitis, maybe within 1 or 2 days it gets resolved by itself due to the body's defense mechanism. Okay, and then the third one is allergic rhinitis. So allergic rhinitis, you have to take steps, you have to rule out why this allergic rhinitis is happening. Either it is because of a dust, it is because of pollution, or sometimes it is because of the if you have pet animals, it is because of the hair follicles. and sometimes it is because of flowers. The pollen grains in the flowers, they can also cause allergic rhinitis. So you have to rule out what is the exact cause of this rhinitis, and you have to treat the cause. Treat in the sense like you have to desensitize, or otherwise you have to avoid exposure with these type of rhinitis causing areas. Then coming to the signs and symptoms, like I have already said you when we were discussing about the pathophysiology, you will have redness of the nose, itching will be present, inflammation, pain, usually pain at the backside of the throat. Sometimes it is like continuous sneezing, coughing, all these things will be present. So, when that is with your signs and symptoms, which is indicating that you are having rhinitis. So, when you go to the diagnosis part, you have to rule out whether it is just a rhinitis or otherwise some infections which is related to the upper respiratory tract. Okay. So, sometimes when there is a severe infection also you have to treat. When there is a running nose, you cannot always think it is just a rhinitis. Okay. So, always have a diagnosis like whether it is rhinitis or otherwise something related with the upper respiratory infections. Okay. So, you have to rule out, and like once you have confirmed it is rhinitis, you have to go in for management. So, what does the management? You do not go in for medical management, it is just a home remedy. Maybe like you have to encourage the child or the adult, they have to start drinking warm waters. So, whatever food you are taking in, it has to be little warm. Avoid cold foods, like it may increase the congestion level, and maybe like warm bath. So, warm showers, so that will help you out. And sometimes if you have like breathing difficulty, see to that like you can take a mild steam, that is very effective in treating rhinitis. And when you suspect it is an allergic rhinitis, always see to that like do not get exposed to the allergens. Okay. So, try to avoid this type of allergies. So, when you come to the prevention aspect, as I said, like you have to prevent exposing, or otherwise you have to go in for desensitization of the pollutants, okay, or the dust or the mitts or whatever it is like you are getting exposed which is causing allergy. So, you have to rule out, you have to prevent all these factors. Hope you understood this rhinitis topic, where we have discussed the definition, etiological factors, the types, pathophysiology, signs and symptoms, the diagnosis, management and the prevention aspect. This is a very small topic, you may get it for 3-mark question or otherwise for a 5-mark question. You may not get for an essay. So, sometimes they will ask you during your practical examination, just they may give you a tricky question telling explain about coryza, explain about pharyngorhinitis. All these type of different terminologies they can ask you. Okay. Hope you understood this topic. So, next class we will talk about a different topic. Until then, take care. Bye.